Hello everyone, my name is Jean Pierre. I am doing this as part of my week 2 assignment for Pathophysiology, a course that I am taking at the University of New England. Today is June 27th, 2022. As I stated before, my name is Jean Pierre. I will be defining different terms that are in association with disease and the disease process. Those terms are disease classification, etiology, pathogenesis, symptoms, signs, syndrome, diagnosis, complication, prognosis, and diagnostic tests. I will not be going over the terms just as I have in the note cards. I'm doing the terms based off my comfort with the terminologies. So etiology describes what sets the disease process in motion, pretty much trying to figure out what are the causes of the disease. Pathogenesis is the beginning in the development of the disease. Okay, a lot of people may wonder, well, what is a disease? A disease is an acute or chronic illness. Disease is acquired. A person can be born with a disease. A good example of acquired disease is like HIV transference from mother to fetus, like by breastfeeding. That's a good example of acquired disease. Diseases causes physiologic dysfunction in one or more body systems. Each disease has its own specific signs and symptoms that characterizes its pathology and identifiable etiology. There's different ways to classify a disease. Diseases can be manifested in a number of ways. Sometimes the condition produces manifestations such as a fever that makes it evident that the person is sick. Other times the condition is silent at the onset and is detected during examination or after the disease is 2 or 4 advanced. So a person goes in for a biopsy and may find out that they have cancer. That's a good example of when a disease is too far advanced. Signs and symptoms work together when it comes to a disease. Signs and symptoms are terms that are used to describe the structural and functional changes that accompany a disease. A symptom is a subjective complaint that is noted by the person with the disorder. Like a person may say that they have pain, they may have difficulty breathing or dizziness. Those are all symptoms. They can't be seen. You can't measure them. You can only go by what the person is saying when it comes to symptoms. Signs, on the other hand, is a manifestation that is noted by an observer, like a nurse, a physician, a CNA. You can see signs. You can measure signs, and signs are objective. Like the observer may see that a patient may have a runny nose or that a patient may have a rash on their skin. Another way to measure signs is like, blood pressure, like checking a person's blood pressure or checking their temperature if they're complaining of a fever. Syndromes is like the compilation, both signs and symptoms put together that are characteristic of a specific disease state. Diagnosis is the designation as to the nature and cause of the health problem. So a physician may try to dig deeper, like look into a person's family history. They may look at the previous history, the present illness that a person may have, the clinical manifestation. They may do a physical exam or a diagnostic test to be able to better diagnose that patient. There may be complications that occur with patients. A complication is a medical problem that occurs during a disease or after a procedure or treatment. Working in the unit that I work in as a step-down CNA, we see a lot of complication being that patients may get blood clots after an operation. So prognosis in healthcare is like making an assumption in advance before they happen. So a good example of this may be like, a physician that specializes in cancer treatments, or dealing with patients who may have cancer, may be able to educate a patient who's been diagnosed with stage 4 cancer that he or she may have, 3 to 6 weeks to live. It's making an assumption. They're giving that person, an advanced assumption before it happens. It's making a prognosis. A diagnostic test is a type of test that is used to help diagnose a disease or a condition. So that can be done through a biopsy, a colonoscopy, and a CT scan. Those are all the terms that we have had with the course as far as Chapter 1 and Chapter 9 are concerned. It's been a pleasure to learn these terms and become more familiar with them. Thank you, Dr. G.